Hi, my name is Jade and I am a specialist midwife in diabetes. I currently work in both the clinic and community settings. Now, what is gestational diabetes? Now, gestational diabetes is high blood sugar readings that develop anytime during pregnancy. Now, we screen women with these following conditions or history. If you have a BMI above 30, if you've got a family history of diabetes, if you've had a baby that weighed above 4 kg, if you've had previous gestational diabetes before, amongst many other things. Now, most hospital trusts will offer you what we call a glucose test between 26 to 28 weeks. Now, if you've had previous gestational diabetes before, this test is offered earlier on. Now, with these tests, we're determined to see if you've got gestational diabetes, and we look at ways to manage it in pregnancy. Now, there are three main ways to manage gestational diabetes in pregnancy. The first way is diet and exercise. We expect you to have at least 3 main meals, and within those meals we want you to have carbohydrates, and we often say if you can try to switch from white carbs to brown carbs, wholemeal carbs, and also we want you to have vegetables within your meals. We also suggest you cutting down on things that have a lot of sugar in them, like sweets, cakes, etc. And also having drinks that have a low sugar in them. So water is always best. If this doesn't work and your blood sugars are still raised, we then look at other options like metformin, which is a tablet, or insulin, which is an injection. Now, the reason why we are keen on managing your blood sugar readings in pregnancy is because there are some risks associated with having gestational diabetes. Now, for example, having gestational diabetes can actually cause your baby to be bigger than usual. Now, because of this risk factor, we do offer scans to check the growth of baby throughout the pregnancy. There is also a risk that if baby becomes too big, at delivery, it can cause trauma to both mum or baby. So we are very keen on looking at your blood sugar readings and the growth of baby. There are also risk factors that you could develop type 2 diabetes later on in life, or develop diabetes again in your next pregnancy if you do choose to get pregnant. There is also a risk that once your baby is born, they could also have low blood sugars. So we need to keep an eye on both you and baby during pregnancy and once baby is born. We would also offer you an induction of labour because of the risk factors of gestational diabetes on or around your due date, but this will be discussed with your consultant obstetrician. So an induction of labour is where we artificially get you into labour to get your cervix right and to get the contractions flowing. Different trusts use different ways to get your body into labour. For example, using diazepam or Propest or Prostine, but your obstetrician will let you know what will happen with you during the pregnancy and labour. Sometimes gestational diabetes can be developed later on in the pregnancy, and this is often found if your baby has a lot of fluid around their body, which is called polyhydramnios, or if your baby's weight or abdominal circumference is larger than usual. Now, with this, we will probably offer you a home glucose test where you can check your blood sugar readings at home, and then we can determine whether or not you have gestational diabetes or not. Throughout your pregnancy, you'll be looked after by a multidisciplinary team. This will include doctors, specialist midwives, and nurses, and a dietitian. Gestational diabetes is high blood sugar readings that develop at any time during the pregnancy. Now, this is mainly due to hormones produced by the placenta. The placenta has 4 main hormones that are produced, and each hormone does something to help the growth of baby and the placenta as well. So when it comes to gestational diabetes, the more your placenta grows, the more women can be insulin resistant. Hence why women develop gestational diabetes. It's something they can't control, but we can manage it during the pregnancy. After delivery, we do expect you to see your GP 13 weeks after for a blood test called a HbA1c. Now, this blood test needs to be taken every year to check for type 2 diabetes, as there is an increased risk of you developing this if you've had gestational diabetes. We also expect you to develop the same diet and lifestyle, because dietary and lifestyle changes can make a huge impact on your health in the future. Final advice If you've got gestational diabetes, don't stress. I know it can be a difficult time. We can work with you with your diet and your lifestyle, and it's a great time to look at the foods that you can actually incorporate into your diet and with your family as well. You've got this.